And some of the clients, they are abusive. If I say let's use a condom, some they threaten me to kill me or to dump me. So sometimes I end up saying we can have sex without a condom.
I was 13 by that time. I was doing Form 1. So I opened the paper with confidence, thinking that I was negative, but then only to find out that I was positive.
Adolescent girls and young women among the 15 to 24 age group remain at high risk of contracting new HIV infections. The causes of new HIV infections include gender-based violence, GBV, declining knowledge on HIV prevention, lack of education amongst adolescent girls and young women, stigma and discrimination, and poverty.
Mama wachona, she was HIV positive, so our father left us. When I was 15 years old. Then she fell pregnant, then gave birth to a baby boy. Then after 3 months she ran away. So I was left with her baby and 5 siblings of mine. So I had to take care of them and pay rent and pay their school fees.
7 organizations have partnered with the government of Zimbabwe and are working for an AIDS-free future for girls and women through a program called Dreams Initiative. The Dreams program is funded by the US President's Emergency Program for AIDS Relief, PEPFAR, through USAID and the Center for Disease Control, CDC. It reflects the US government's decision to address health intervention issues in a new and creative way in a bid to deal with economic, social and cultural factors that put girls at a higher risk of HIV. It has been launched in 6 priority high HIV burden districts in Zimbabwe. The 7 organizations are together providing a comprehensive set of services to each girl in what is known as a layered package of services. Sub-Saharan is disseminating information on HIV and AIDS in the classroom through in-school clubs, sporting activities and coaches. In schools, Sub-Saharan has introduced a GBV desk and box to make it easier for girls to report cases.
Most of the girls are now really empowered. Whenever they have been abused, they know where to report. We've got the material which were given during the training. The teachers use those materials to teach the kids. As a club, we did mapping around the school to see which areas really kids become vulnerable to. They told us that behind the toilets, in the sheds. So as a school, we now know where they do misbehave and we target those areas.
Through the Dreams Initiative, UNICEF is working with the Ministry of Labour and Social Welfare to provide cash transfers to poor families.
Vakasvika pano vakandibvunza mubvunzo yavakandibvunza ndikapindura ndikavaudza ndine vana 4 vari kuenda kuchikoro. Tafadzwa ndianga ari mukuru achita Form 3. Ndikavaudza kuti handina fizi yevana, tisina mari yerendi, ndasingashandi, panopamba test tafa tisina kana chekudya.
As a teen mom, it was hard to support my son and myself. So now I'm in Dreams. I now have a skill. I'm doing motor mechanics. I'll work, support my son and myself.
As a young woman living positively with HIV, Musa has been trained by Zandiri Africaid and Sub-Saharan to become a CATS member and an out-of-schools club facilitator, respectively.
It simply means Community Adolescent Treatment Supporters. I am involved in health talk facilitations at the clinic, and I also have one-on-one sessions with other adolescents and also mobilize people for HIV testing.
Through Services Zimbabwe, PSI is using the sisters clinics to reach out to women who sell sex with HIV testing services, treatment and prevention, including distribution of pre-exposure prophylaxis, PrEP, a pill taken every day to prevent HIV infection. Population Services Zimbabwe is complementing this with youth-friendly family planning services.
When I'm using PrEP, I'll be feeling my chances of getting the virus are low and I'll be feeling safe. I came to Sisters Clinic, I got tested, I was treated STI, I was given family planning, I was also given condoms. Mzingwane, they helped me. I'm now back to school. I'm doing my Form 3.
The aim of the DREAMS program is to raise a generation of determined, resilient, empowered, AIDS-free, mentored, safe women who will pursue a chosen career and become financially independent. To achieve this, World Education Incorporated Bantwana is providing job preparation, vocational and life skills training, internship programs, and is giving knowledge on internal savings and lendings, ISOs, to the young women. World Education is also providing financial assistance through the part-time continuing education program.
My future, 3 years from now, I'll be a qualified engineer, and then I'll go back to school, or level, and then from there I'll keep on going up to PhD, and then after that I'll have a brighter future for myself and my son, so that my son will not face the same things that I faced in life.
Do you know the status? I know mine. I am a hero. I am a hero.
The DREAMS program in Zimbabwe is working to reduce new HIV infections among adolescent girls and young women by 40% by the end of 2017.
I am a victor. I am a victor. I am a victor.
The DREAMS program is coordinated by the Ministry of Health and Childcare and National AIDS Council and is made possible in Zimbabwe through the generous support of the American people.